Okay.
Okay, so I think we're recording. Good
Wonderful.
morning.
Good morning.
How are you today?
I'm well. How are you?
Good. It's cold here in St. Louis, but you know what? We're getting through. So, for those people who have just started watching us or who are just joining for the first time, I'd just like to remind everyone I am Megan Holmes, and I am here in what has turned out to be a pretty cold yet sunny St. Louis, Missouri, at my shop, the Needlepoint Clubhouse. And together with my friend Melissa McLeod, who owns the Wool and the Floss, we have been doing this podcast, the Pointing It Out podcast here on YouTube. So we are super excited, Melissa and I, to welcome and introduce you all to Deryl. Introduce yourself, because I want to make sure that I get your names and your accolades all correct.
Sure. So my name is Deryl Pace Lavers.
Okay.
I'm married, but I'm getting married again, so it's that in between stage.
Darn COVID wedding.
The delayed wedding. So,
Yes.
But yes, I am Deryl Pace Lavers. Have a doctorate in physical therapy, and I work full time as a physical therapist in an outpatient clinic. I live here in East Providence, Rhode Island, and I work nearby in Rehoboth, Massachusetts.
Very nice.
Yeah.
So that must mean you're nearby our friend Patty. Or no, is that Rehoboth? No, that's further south. There must be a Rehoboth Beach and a
Rehoboth, Delaware.
Delaware.
Beach. Yes.
Here it is. I don't know my East Coast cities very well, obviously.
Many times confused. Yep.
Anyway, Patty is at Stitch Stash in Rehoboth Beach. But anyway, I digress. So as Melissa and I continue to develop content for our podcast, we've kind of been talking a lot about the ancillary kind of people and effects and just, I guess, for lack of a better term, things that affect all of us as stitchers. Mm-hmm. And so one of the things that we're very interested in and have been talking a lot about is the effect that stitching is having on our bodies. And so it sounds funny, but we actually do have overuse injuries, I guess, for lack of a better term.
Yeah.
So I said to Melissa, I would like to find someone who is part of the medical community to kind of have a real discussion about the physical effects of needlepoint on our stitching bodies.
Absolutely.
Yeah. And so we kind of talked about, should we contact a chiropractor, an occupational therapist, a physical therapist, an MD, an orthopedist. I mean, there are so many of you in this sort of category of this, I guess, in medicine. But we kind of came to the fact that we thought, well, let's start with a physical therapist. So I put a message out on one of those wonderful Facebook boards, and I said, hey, does anybody know a stitcher who's also a trained physical therapist? And one of the messages I got, I think you'll laugh, was, oh, I don't think there's anybody out there like that. That's a tall order. And I thought to myself, I don't know, among our fellow stitchers and among our community, surely there's somebody who has both stitcher and medicine / physical therapy behind them. So we were delighted to find you.
It's and a lot on the hands.
Say that again.
It's a lot on the hands.
Yeah, exactly. Well, yes, because so let's talk about that actually. So your education is in physical therapy. And as such, do you have like a focus or how does that work? Can you talk a little bit about that?
Yeah, so I work in an outpatient physical therapy clinic. So we work with a variety of injuries and conditions. Our patients could be coming to us after surgery, after breaking a bone, after straining a muscle. I also see a lot of elderly clients for basically deconditioning and fall related injuries.
Okay.
So my youngest patient has been, I want to say, under 10. My oldest has been 98.
Wow.
So there's a wide range.
And so you don't focus just on the hand or just, I mean, I know that there are some people.
I'm a general practitioner, essentially.
General practitioner. Thank you. Okay.
I treat everything. I consider myself a manually based therapist. I'm in a pretty manually based clinic. We really value our hands and our ability to help our patients decrease their pain with mobilizations, with manipulations, with tissue work. And as our patients get better, we're always treating them exercises and stretches and such as we go along. But, as my patients get better, the manual therapy tends to go down, the exercise goes up. And
Interesting.
so I'm basically giving them all my tips and tricks to try to put myself out of business and
Right.
make them self-sufficient and independent.
Well, the good news is that at least for those of us in our stitching community, I don't think you're going to run out of patience anytime soon. So, so I do want to throw out there, and I probably should have said this at the top. We want to ensure that people are using this conversation as just kind of information gathering. We're certainly not here to provide any medical advice. That's not what this is about. It's really more about trying to learn what parts of your body might be bothering you, what it might be called, so that then when you do contact your medical provider, you're a little more able to kind of have a conversation that is
Exactly.
educated and informed. So anyway, so what we talked about is, Deryl just kind of gave us an idea of what she does on a daily basis. And so when I picked her brain, I said, so let's talk about needlepoint and how that affects our body. And we talked about a lot of different things. So from back and posture and your seated position, we've talked about arms and hands and wrists and joints and fingers. And I guess what from your from where you sit as a stitcher and from where you sit as a physical therapist, can you talk about kind of things that you think are maybe plaguing people who are watching us and
Yeah,
kind of
yeah.
help us describe what those things might be actually called instead of me just saying my thingy hurts?
Overuse injuries are very prominent. They can happen in any hobby or profession, anytime you're doing things overuse over and over again. And think about how many times we're stabbing a canvas
Uh-huh.
over and over. That's definitely repetitive.
In the same rhythmic motion. Uh-huh.
Exactly.
Mhm.
I saw something recently. I think a woman said that she stitched a belt in under a month or something, and her hand was a little sore after working on 18 mesh for that long, and she's giving herself a break. Good idea. Yes, I speak from personal experience. Yes, that is going to add up after a while.
So personally, when I think of a person who was stitching a belt in a month, I think, this is going to hurt for me. This whole area, this pinching
Yeah,
motion.
I mean, so when you think about an overuse injury, you think that you could potentially be hurting muscles, you could be straining joints and muscles, you could have inflammation in those joints. And so, instantly I think of tendonitis.
Okay.
There's a difference though between tendinitis, itis at the end of that, versus tendinosis. Tendinitis is the more acute inflammation version around a tendon, and tendinosis is more of the chronic version. If you've had it for a long period of time, into months, into sometimes years, people struggle with this. And tendinosis usually has to do with the actual breakdown of the tendon involved. So be mindful of your body. I would say use pain as your guide. If you're having pain night after night while trying to stitch, take a break. Take a break or try some ways to reduce the inflammation or the pain.
So I think what I'm hearing you say, I just want to make sure from a layman that I'm understanding.
Yeah.
So what you're saying is tendonitis is developing, and what you don't want it to do is develop into
The tendinosis.
Right.
So if you have tendonitis, if you have inflammation and pain in there, talk to somebody. And I would definitely say talk to somebody if you're noticing that it's hurting, not only when you're stitching, but also in other avenues of your life. If it hurts you to try to prepare a meal.
Gotcha. So if your hobby is causing you to not be able to make dinner for your family, that's really good excuse not to make dinner for your family, but let's not let that interfere with everyday life. So let's talk about tendonitis though, because I'm kind of a dummy when it comes to the muscular skeletal. So do I have tendons in here? Do I have tendons in here? Do I have tendons everywhere?
You have tendons for every single muscle in your body.
Okay.
The muscle belly attaches to a tendon, and that muscle has to attach at some point to the bone. And so it attaches to the bone by a tendon.
So how do I know, like, when the pain here or here or here is the tendon and not the muscle, or is it probably both?
It's probably both. So you've heard of the term like carpal tunnel as
Yes.
well. So carpal tunnel is you have this group of bones in your wrist called your carpals, and they form an arch. and then there's a ligament over the top of it. And all of your forearm flexors from this part of your arm go through there to attach into the hand to flex our hand. So they all go through this tiny tunnel, and that tunnel itself, you can have inflammation in there.
Okay.
And something else that goes through that tunnel is your median nerve, and your nerve can get inflamed. And that's how a lot of people describe carpal tunnel, as like numbness and tingling in their hand.
Okay.
Because you're essentially compressing the nerve.
So I'm glad you mentioned that, because I feel like kind of in jest, or at least in conversation we have here in the shop, because we're all women and we're chatting, someone's like, oh, I think I'm developing carpal tunnel. And to me, that sounds like a very end stage comment. But am I right about that? So in other words, like right now, I have some soreness in my wrist, right? Like I can kind of feel it. I can kind of work it through, but I wouldn't say that I have carpal tunnel, right? Aren't there some things that I can probably?
I mean, you have to be diagnosed. You have to be diagnosed by a physician, by a physical therapist can diagnose you sometimes with that as well. Technically, I can say I think you have carpal tunnel, but let's send you to the doctor, get some extra imaging, have them make the ultimate decision. And so it's quite possible that you could also have, joint related pain.
Sure.
I have a pretty, so arthritis, for example,
Yes.
can come on. Arthritis is just wear and tear in your joints.
Okay.
Every joint has cartilage between the bones. The only time that we don't have arthritis in our bodies is when we are small infants and we've just been born. As soon as we start crawling, moving, walking, we are creating wear and tear on our joints. And so arthritis is just wear and tear. Mm-hmm. So if you think about it, you have so many joints in here, it's quite possible that you could be developing some wear and tear arthritis in there as well. So there's a difference though between osteoarthritis, which is wear and tear on the bones of the joint, versus rheumatoid arthritis, which is, a rheumatological immune condition with inflammation in your joints.
Gotcha. So we're talking a lot about this area of the body, but there's also, there's muscles, things that go up. There's, so let's kind of move. So talk to me more about the other parts of the body that can be,
Right. So I think the best thing I can do is explain, and I'm going to show you this. These are
good.
From a presentation that I had as a student of physical therapy at the University of Rhode Island when I was getting my doctorate. So now, so these are all images from Netter. Basically, they show the spine. You can see, you have 7 cervical vertebrae up here. Your thoracic spine is in the middle where all your ribs attach. And then your lumbar spine is at the bottom. You have 5 lumbar vertebrae, and then you have your sacrum. And then, so we have nerves that exit the spine at every level. So your cervical vertebrae pretty much innervate your arm, and then your lumbar vertebrae innervate your legs. So in this image, can you see that now? The clavicle and the shoulder.
I'm actually about ready to giggle because I'm thinking, I hope we don't have leg injuries related to me. I think it's just the upper body.
Who knows? But like,
to each his own. But yeah. Okay. So go ahead.
So basically there are nerves that exit your neck and through the arm, and there are places where they mix together and create nerves that innervate the arm. And so
hold on, let me just, innervate means make it move.
Yes, they motor and sensory.
Okay.
So, motor means the nerves are telling the muscles to move, but then also sensory information has to go back up to the spine to get to the brain.
Gotcha.
So
it's telling you whether it's in pain or it's not feeling quite right.
Exactly. So, these nerves travel a pathway from your neck through your shoulder, down the arm, and at any point they can encounter a situation where they might get pinched, or inflammation could make them get kind of restricted or cut off. And that can cause symptoms further down the arm into the hand. So that could happen at the neck level. It could happen in the shoulder, could happen in the elbow, the wrist, the hand.
So if I'm feeling something here, there's a chance that it could have been affected up here because of some kind of motion thing. And now I'm saying, oh, my hands hurt. But really, it could be something all the way up here that's causing that.
And that's the
Interesting.
situation where you never want to try to self-diagnose and treat, because you could think that you have carpal tunnel because you have numbness and tingling in your hand,
Mhm.
but it's the therapist or ultimately your doctor that's going to identify and say, if you have numbness and tingling in these fingers, I don't think that's carpal tunnel. That could potentially be coming from your neck or further up your arm. And
Interesting.
that's why you want to seek help. I usually tell people that if you try, anytime you have an inflammatory condition, you can try ice, you can try taking NSAIDs, anti-inflammatory medication like Aleve or, something like that. If it doesn't get better within a week of like taking a break from stitching and trying those things, I would say, see a doctor, see a physical therapist.
Yeah, and we kind of have we're kind of, believe it or not, you guys, I actually have a little bit of an outline. So we're going to get to that whole piece on when
Yeah.
to seek some intervention from a trained professional. But what we wanted to just sort of talk about is the way sort of, you just did a great job explaining, like, you just don't know. It could be up here, it could be down here, it could be whatever.
Yeah.
And so I'm thinking that those are the main ailments that would play with
Yeah.
culture, right? Neck, shoulder. I've heard some people say
Shoulder,
elbow.
elbow, like tennis elbow. Believe it or not, I have seen some people that do repetitive gripping activities develop tennis elbow. The medical term for it is lateral epicondylitis.
Woo,
And
that's one.
yes, ITIS is just acute inflammation at the elbow where those tendons attach.
Nice. I
So,
love it. So I think we've done a relatively good job in a
yep,
short amount of time of describing kind of where these things can be coming from. And so you kind of touched on it, but I think sort of the next thing I'd love to kind of just talk about, and again, we're not here to solve anybody's medical issues, but
right.
just to kind of say, so I'm having trouble right here. This honestly, this is I'm being very, very selfish right now. This is my personal issue. I get what I think is like a trigger situation here with
Yeah.
this hand here. So for example, if you're having some trouble with your hands in this way, like let's start here at the tips, right?
Right.
What are some ways? So I think I can think of some sort of common sense things that I could maybe do, but
Mhm.
talk to me about what, like, observationally as a professional, what do you think?
You want to try to reduce the stress of what you're doing all the time. So, yes, you could take a break, but I say this to athletes too. Who am I to tell you to stop doing what you love?
Love,
I'm never
right.
going to tell you to stop doing something altogether. I might say take a break, try to cut back, but I'm not going to tell you to stop. There may be ways to reduce it. So, reduce the stress. You could use those silicone thimbles.
The pinchers, I love those things, the
Yes.
pink things.
Yep.
So, and what I like about that, and I love hearing that you say that I'm actually doing the right thing because I'm, clueless over here. What I have are these, and I wish I had brought them over, but they're these two little pink things, and I actually put them on both fingers.
Yep.
So to me, what that does is it allows my finger to have a little bit of a break because the grip is pulling it, but it also puts just a tiny bit of space in there,
Mm-hmm.
so I don't have to pinch so hard.
Right, right. So you're reducing those muscles. It's these muscles in between your thumb and your index finger that help you with the pinching. And so, if you can reduce that stress on those muscles in there, absolutely. But then
So
also think
go ahead.
about this. You have a joint here. I'm
Oh,
trying to come in real close here so you can
yeah.
see. This is a joint here between these two phalanxes, and then this phalanx or phalange, this bone has a joint to this one. So that this is your CMC joint is your carpal metacarpal joint. So your carpal bones are in your wrist. And hold on, I'm going to show you this because this is going to be better. I'm not explaining myself well. Let me show
You're
you.
doing a great job. I'm fascinated. Keep going.
Can I? Here we go. This is the hand.
Great.
Can you see that? So, if you look up here, these are all the bones that you have in your wrist
That's
up
the wrist.
top.
Okay.
Yep. And then this, can you see my pointer when I do this?
Mhm.
Okay. So this is your CMC joint, your carpal metacarpal joint. I'm wondering if that could be the source of your injury. But again, I can't diagnose you through a screen.
Sure.
And without physically putting my hands on you, I can't
Right,
diagnose
exactly, because you want to feel. But so moving down, is this those white? I'm sorry, I'm like such a
you. These
dope.
are ligaments and joint capsules. Yep.
So that's soft tissue.
Yep. Yep. And
So
so this is your metacarpal in your thumb. This is your phalanx bone,
okay.
phalange. some people say. So yeah, these right in here. So you have joints everywhere in your hands.
Yep.
So think about it. It could be a joint injury. It could be a muscular injury. It's hard to diagnose.
So one thing I can do to relieve some of that pressure for myself is to use those little puller things.
Mm-hmm.
Another thing I'm wondering is there any kind of manipulation I can do by myself? Like you just mentioned like a leave, an inset. I don't know those.
NSAID, NSAID. It's basically like a non-steroidal anti-inflammatory drug.
Which would help reduce the inflammation of that soft tissue.
Yep, Aleve, Motrin, aspirin, Advil. Yep.
But so is there any kind of like would you suggest ice or heat
Yes.
or
Yes.
manipulation, like little self-massage thing, I don't know, like
So to talk about ice and heat, anytime you have an inflammatory disorder, I usually would say I lean more towards ice because ice will reduce that inflammation.
okay,
Heat
okay.
may feel good on the muscles, but sometimes heat can actually make inflammation, especially if you're in the acute phase, heat can make inflammation worse. So, I always say that if you're going to use heat, make sure you finish with ice so that you can then, you can alternate back and forth between the two.
Okay. Okay.
So I often tell my patients, especially when they're working in small areas with joints, elbows especially,
Okay.
have you ever seen those tiny bathroom Dixie cups? They're made out of paper.
Yeah.
So take some of those, fill them half full with water and freeze them. Take them out of the freezer, peel away the paper so that you hold the paper on the bottom and then there's ice exposed on top, and then rub it on your hand.
That might be the best nugget we just got all morning.
Yeah, you are now
How many years
doing
of
what's called
school?
an ice massage. And ice massages are fantastic. Now, I'm going to say this with a caveat. Be very careful because as you do your ice massage, you're going to go through a few stages. First, it's going to feel like intense cold. And then it's going to be like a burning cold. And then it's going to be an aching cold. And then it's going to be numb. When you're numb, you're done. Don't go further because you do not need to give yourself frostbite.
Okay. Then we need to get a dermatologist on here to start talking about the skin. But
That's my caveat.
that's a very cool. So I could do that here too, because this is another spot.
Absolutely.
So,
Yep.
so moving up the arm, so the wrist gets sore, right? So something I do to
Absolutely.
help with that
Yep.
is a frame,
Mhm.
number one,
Yep.
because instead of having to crunch my canvas together, the
Mhm.
frame kind of the gravity can kind of set the frame on my hands instead of me having to grip it.
Yep.
And also a frame stand is also a solution to
Exactly.
relieving your hands of any kind of pressure, I guess.
Right. Right. So, I mean, I think I've even seen some people, they'll like balance the frame in their lap or something
Yeah.
with one hand. So they don't even really have to grip it. And then they're, going back and forth that way with their other.
Like around, yep.
Frame stands are fabulous. I've seen, lots of women with chairs and frame stands, and they're so reclined and in perfect alignment. And I think that's great because it really reduces all the stresses on their spine while they're, needle pointing, and it's right in front of them at like eye level or, about so that, they're really trying to stitch with as little stress on their bodies as possible.
That's amazing. I hadn't thought about that. To me, like reclining, that just feels kind of lazy, but I see what you're saying.
Yeah.
Because then also your spine is, the idea is that you don't want to be like doing this kind of thing, right?
Right. So as I'm sitting here, I'm thinking to myself, because I'm sitting on a kitchen stool, so I don't have a back support, but my relaxed position is with my shoulder slightly forward. Now, keep in mind, I'm often treating patients like this all day long. So I have to constantly do exercises to kind of bring myself back to normal. So if I turn to the side, you can see posture wise, if I'm sitting here, my shoulders are slightly rounded forward. That's my normal because I have tight chest muscles and pecs in the front of my shoulder. But then also can you see the middle of my ear? Is that relatively centered on my body? Most of us, because of our phone habits, tend to have a forward head position. We also just have that in general because of like a slump posture. So forward head can cause tightness in our necks, can cause nerve injuries in our neck sometimes, posture wise. You could develop a shoulder injury like an impingement, which is basically just things are getting pinched in the shoulder because of posture with rounded forward shoulders, because that closes off that joint.
Gotcha.
So, posture plays a huge role in having us be pain-free. And oftentimes, especially amidst this pandemic, I will tell you that because people have been home more, because they've been sitting more or less active, postural related positions are really starting to come into play. And I basically work with my patients and educate them on posture every day at my job.
So would you suggest, like, let's say I'm, what I want to do right now is like sit underneath a blanket and just kind of cuddle in on the couch and like sit there and do my stitches.
Yeah. That's what's comfortable, and that's fine.
But would it be worthwhile to say to myself, like, hey, maybe I should think like every 30 minutes, every 15, just stand up and like give your body a little break? I mean, does that help, or does that just sound like a good idea?
Absolutely. Absolutely. I tell my patients that sit at home office desk setups every day. I tell them to try to stand once an hour, because
once an hour.
Good. Helpful thing to get up and get moving, spend some time standing, maybe do some of their stretches. So if you're going to be there, that's comfortable for you at the end of the day, you're winding down, you're relaxing, that's fine, go for it. Mm-hmm. But just know that you need to balance that time in that position with other times where you can stretch, where you can, get your body back to normal and try to reduce the stresses that you were in before. So some people that have like a normal yoga practice, that's excellent. That stretches what needs to be stretched. If you don't have some kind of normal exercise routine, then that's when I can come into play and be helpful at recommending some stretches that you do on a regular basis.
But without having like real diagnosis or having a patient, I mean, wouldn't it just be safe to say I could stand up, put my arms up, kind of just do some shins around? Yeah. I don't know, just to like get the blood flowing and get changing position. Like simply changing position is probably.
Yeah, okay. Absolutely. And then also, I think in one of the online groups on Facebook, there was a post earlier this year, or last year rather now, from somebody I think that was stitching canvases, and she's actually a fellow Rhode Island stitcher.
Oh, nice.
Elizabeth Crane Schwartz, I think, shout out.
Yes.
She was talking about painting and how, her posture, and she was like, are there any ways to reduce the stresses on my neck, on my shoulders? And I had said, there's some things that you can do, bring it up to eye level, try to sit, with rather than being in the hunched position, try to, bring it up this way, maybe an easel. But then I also put some just great, I would say, basic stretches that would be good for most anybody to do, and said, if you try these and it's not getting better, go see a physical therapist, go see your primary care. And I can actually share those with you. They're just pictures from my home exercise program that we use at our clinic.
Oh, cool. And maybe we'll put that in the notes.
Through your shoulders, how to stretch your neck, that kind of thing.
Just to kind of, that's a great idea. Let's remember to maybe put a link in the notes or a PDF or something. Yeah. I'm glad that came up. So I think we've kind of covered, I'm sorry, did you have something else to say?
One other thing I wanted to mention, the ice massages are great. Also, something to keep in mind is the gel pack ice packs. I am a big fan of those because they're reusable. Also, they don't melt, and so they're not going to put ice
all over the place,
all over you or all over everything. I wanted to show you these.
Yeah.
Thankfully, I'm in my kitchen.
Cool. This is perfect. You have a beautiful kitchen, by the way. It's very clean. Much cleaner than mine.
Well, I did maybe clean it for today.
Okay.
But
you don't have to tell us.
It's a gel pack.
Okay.
It's actually like a foot long.
Yeah, it's big.
It folds. You can wrap it around certain body parts if you need to. You could wrap it around a hand if you needed to. These are made by Chattanooga. It's called a COL. I think you're seeing it backwards. CC. But basically, I most recommended to buy these for ice because it's just so easy.
Right. It doesn't make a mess.
Yeah, and you can take it in, put it back, whatever you need. So.
I can just nestle it in with the Eggo waffles that my kids eat. Like, sorry, I haven't gotten endorsements or anything, but frozen waffles in my freezer.
My husband and I, we use them all the time in our lunch boxes. So, I mean,
like multi-purpose.
Yeah.
Perfect. So I think we've kind of talked about like the general areas where, and we kind of talked about, let's do some stretches, let's do some ice, maybe a little bit of anti-inflammatory medication, et cetera. But when when those things have exhausted themselves for me. So I'm saying I'm just getting so much pain. I don't want to stop stitching. I'm not going to stop stitching. I've done some ice. I've taken this. I've done that.
Yep.
Let's talk about again, you made the point, listen to your body, make choices. But to me, the medical field is so vast.
Yep.
I don't really know. I mean, like I said at the top here, it was like, do we call it a PT, an OT, an MD, a chiropractor, a massage therapist, what? So, I guess my next question for you is like, when do I seek professional advice aside from this podcast?
So when it starts interfering with your other daily activities, whether functional or recreational, absolutely. That's when I would reach out and ask somebody for help. And then you have lots of people on your medical care team in your corner. You could have your primary care physician. That's a great place to start. You could also have an orthopedic MD that specializes in specific bones or joints. Chiropractors are also excellent. They help a lot with the spine and alignment. That's all very good. OTs are excellent. My fellow rehab counterparts. All of us, and there could be one person that sees all of those people, and that's fine. And we can all basically talk back and forth and with the patient's permission and be a comprehensive care team. Awesome. We're all medical professionals and we always refer back and forth to one another. I have some great relationships with primary care physicians in the local area, orthopedic MDs, chiropractors. I'm constantly referring my patients back and forth between them. And that's always, very nice to have.
And so it wouldn't be, I'm pretty, what's the word? I'm like out there. I'm not too embarrassed, but wouldn't be embarrassing for me to like call my MD or call a physical therapy and say, I needlepoint and I needlepoint to the point where I now have an injury in my hand. I mean, wouldn't it be okay for me to bring a frame in?
Absolutely.
Explain what I'm doing in the motion that, and so that, wouldn't that sort of, I'm just guessing, help you gain even more information to be able to help me out, right?
100%. Yes. Can I actually, you're so funny. You just reminded me of this. I told you that I wanted to speak with my boss before I agreed to do this podcast.
Oh yeah. Right.
One, I'm representing my profession, but I'm also representing my clinic.
Correct.
And when I had this conversation with him, and this is too funny. I told him that I wanted to do this and he was like, hold on. So you're going to speaking about needlepoint injuries. And I was like, yep. And he's like, so not concussions, not knee pain in athletes, needlepoint injuries. And he burst out laughing. So there you go.
He's like, okay. And what he should be thinking as your boss is, this is some business development. Yeah. It's serious. And I know it sounds silly, but
so I can speak from personal experience that having your stitching with you to be able to show your medical doctor is very helpful. I haven't told you this yet. A couple years ago, I had a hand injury. I actually tore the flexor tendon off the ring finger in my left hand on Halloween night in 2018. I grabbed a dog leash, my finger hyperextended. The flexor tendon tore off and it bunched up in the palm of my hand.
Ow.
So when I tried to make a fist.
Wait, is that your right hand?
That's my left.
Okay. Are you a lefty?
I'm a righty. I look like this. I physically could not bend that finger.
Oh my gosh.
And so as a result, if you look at this hand, I'm going to show you this way. Do you see how all those fingers can come down nice and tight? This one, not quite all the way with that.
Oh, how funny. But you've made a lot of progress, it sounds like.
So as a result, I was out of work. I had to have surgery to reattach it. I was out of work for 12 weeks because I work in such a manual clinic that I couldn't risk potentially rupturing my repair. So, but, I told my doctor, and as I was starting to come back and I was like, when can I start stitching? The entire time that I couldn't use these fingers because all of these fingers are attached to the same muscle in my forearm.
Okay.
So I was in a brace that didn't allow me to flex any of these guys. I could basically only use my thumb on that hand. So I was able to, and I'm going to use this as a result, as an example, I could hold, I could do a finger.
Oh, that's
Um,
so funny.
but so I could almost hold the canvas, and then I was trying to do it that way, but it was like, as long as I wasn't using those flexor tendons. So I was able to have that conversation with my doctor and say, this is what I'm trying. And then ultimately I was able to tell him, in more detail, the still having trouble with.
Right.
Um, and so, he did my surgery. He saw me on a regular basis after my surgery. And then he helped me manage my symptoms that were still continuing. I actually had some cortisone injections. That's another option that we can talk about that you can, do with a specialist.
Sure.
Um, but yeah, ultimately I'm maybe 95% there. Now the only problem I have is pulling ropes on a boat when I'm sailing, because think about it, those are really, you need a full grip for those guys.
It's not like it's kind of like pulling pearl 3 through an 18 count mesh single. Yes, I understand it.
So
But I
back to
think
where we were though, if you have pain, go see somebody. And depending upon what state you are in and what kind of insurance you have options available to you. So the great thing about me being a physical therapist is that most states in the US have what's called direct access. So if you have the right kind of insurance, you can skip going to your primary care and getting a script and a referral, and you can go straight to your physical therapist.
oh, so it depends on the state, not your insurance
It
necessarily.
depends on both,
Okay.
actually. So for example, a patient who has Medicare, maybe they're, over 65, they're retired. If they have Medicare, unfortunately, with a Medicare patient, I usually always need a script from the MD.
Sure.
But sometimes I actually have some Medicare patients that will walk right into my clinic to see me. Usually they're returning patients, and I'll say, oh, hey, good to see you again. Let's just call your primary care and see if they'll send a script over to us. And usually they're happy to fax it right over and have us see that patient very quickly.
That's great. That's great communication.
Not every primary care is that comfortable. There are, I would say, 9 out of 10 primary cares, if they know that patient well, they see that patient regularly, and they know that that patient has had injuries in the past, then they're fine to send a script. Sometimes if it's a new injury that primary care has never seen with that patient,
Right.
or maybe the primary care hasn't seen that patient in the past year or two,
Right.
then they might say, can you send them back to me? I need to see them.
I better evaluate the whole thing before we
Exactly.
hop into
Yep.
some treatment. I gotcha. Yeah.
So I have a great document I'm going to share with you.
Okay, great.
And we can link to this later.
Cool.
This is put out by the American Physical Therapy Association. And it shows what states you can have direct access in.
Oh, big red spot on Missouri.
Yeah. So I don't know if you can see this, but so most states have some form of direct access, but some are more restricted than others. So for example, Missouri, Mississippi, and Alabama are pretty restricted.
So
And
that
then
just means, I'm sorry, go back over that again. That just means that I probably need to go to my
primary care first, and then
Before I
come back. I actually was reading the Missouri one later, and people can read this more specifically for their own state. I think in Missouri, let's say that you saw your primary care for your thumb injury, saw the PT for maybe like a month or two, and then you decided that you were ready to be discharged and you were off on your own. And then you had an exacerbation and your pain came back. I think, if I'm reading this correctly, in the state of Missouri, you can go right back to the physical therapist. You don't have to go to your doctor again and then back to the PT.
Oh, interesting. So,
So,
I find that I get very overwhelmed by all this information. So is
yeah,
it worthwhile to even just call a local PT clinic? I mean, it sounds like you're very versed in this, and maybe I just call and say like,
yep,
hey, obviously they're in the state that you're calling, you call like a local place and you just say like, here's what I'm trying to do. My guess is that a professional like you
yep,
might be able to at least direct a person in the right.
exactly.
We all know that Google can be a black hole.
Right. Try to stay off Google and all of that medical information. I would say that any good physical therapy clinic will be able to tell you what you need to do in order to be able to see them, because they want your business.
Right.
So, and always just call your primary care and ask them that question too. Sometimes they don't even need to see you, especially in the midst of a pandemic. You may not want that exposure. And so just, usually they'll send a script to a physical therapist that they can suggest, or if you have one, you can suggest it. And
Right.
that's another thing that I want to point out. And I'm going to stop this share in this document, but we'll link to that so that people can look at it for their own specific state.
Sure.
You, as the patient, are your own best advocate. So you get to choose where you go. And please don't ever let anybody pressure you into going to one specific location. There are some great members of every profession, and then there are some that might not be as great, and there are some that sometimes are more focused on the bottom dollar. And so it is my job to basically say, I want you to go to a place that has one-on-one care, meaning that your therapist is not splitting their time between 2 or 3 patients at the same time. They're only with you. Go to a place that has one-to-one care. Go to a place that, you know, prioritizes the patient first rather than the bottom dollar.
Well, and you mentioned something to me when we were talking, and I had the note here that the firm or the practice that you're part of is
Yep.
hold on, I'm missing my, you said something about it being like a multi, oh my gosh, I had a note here and it was really good. But like a multi, so like you have physical therapists there, but then don't you have like a massage therapist that's sort of in the practice that you might be able to kind of
Yeah. So
I thought that was really interesting.
my clinic has 6 full-time physical therapists. We don't have any physical therapy assistants.
I found my note, integrated services.
Yes. Physical therapy assistants or aides. Sometimes in the bigger PT practices, you might start with a physical therapist, and then you get passed on for your exercises to an assistant or an aide. And the aides they don't have actual degrees or skills. Physical therapy assistants have a 2-year degree, and they can be very helpful in big practices. But what I'm trying to say here is, like, in the practice that I'm in, all patients are seen by a physical therapist one-on-one for 45 minutes. And that is a really great model to be able to do. We do have a massage therapist that rents a room from us in our clinic. And sometimes when patients exhaust their allowable visits from their insurance, or when they're feeling better, but they want to continue to come in and see a massage therapist for maybe maintenance therapy, you know, we can refer them to her. And sometimes she will be seeing patients and she'll be like, you know, I think you should talk with a medical provider rather than just seeing me. And she'll refer patients back to us. Again, that's that referral relationship, and it's wonderful.
Right. Yeah, I really liked that. I like a collaborative approach. You know, we're not all, we all have a little bit of information, but we all don't have all the information. I mean, in any industry, in any practice. So I think that's really interesting. You know, this has been an awesome conversation. I have just thoroughly enjoyed it. I don't know anything about the medical industry. And so your expertise and your education has been just super helpful. Is there anything we haven't talked about that you think that I missed, or do you think we've covered it?
I mean, I think we've covered a lot of things. Yeah. Absolutely. I'm going to say one more thing. You know, there's a difference between a physician-owned practice for physical therapy and a physical therapist-owned practice.
Yeah.
So if you go to see an orthopedic MD and they, you know, want you to see their physical therapist attached to their clinic, know that you have the right to go wherever you want to go.
Sure.
And so it could behoove you to see a physical therapist in that clinic, but technically that's a referral for profit situation. If there's a place that's convenient for you in your local town, you are always welcome to go there too.
So I think what you're saying basically is just explore your options. So if something feels iffy, or if you go and you're like, this person isn't right for me, there's probably another physical therapist down the street who may be a better fit for you.
You are your own best advocate. Absolutely.
I love that. I love that. And also don't let things go too far. You know, like don't sit around and be in like total pain, because there's help out there for you.
Absolutely.
Well, good. Well, this has been really fun, and I really appreciate your time, your patience with me, because this has been a snow week, and we actually scheduled this a couple times. So thank you so much. But as just a note, so if you're subscribed to the Pointing It Out podcast, that's great. If you're not, please subscribe. And in the notes of this particular episode, I think what you and I will do, Deryl, is just make sure that we either have links or suggested websites or somewhere to go for those documents that we referred to earlier.
Absolutely.
Okay. Well, thank you. And again, thanks everybody for watching, and I don't know, happy stitching. Have a great day, all the things. So, all right, take care. We'll talk soon.
Bye. Thank you so much for the opportunity.
My pleasure. Bye-bye.